When a new patient comes in for treatment, he's placing his trust in you. You may be confident of your skills, your experience, but for a new patient, you're a leap in the dark. How does that patient know he's in excellent hands? Accreditation. The Accreditation Association for Ambulatory Healthcare, or AAAHC, is the leader, with more accreditations in the ambulatory healthcare arena than any other accrediting organization.
For many years, the AAAHC has been the accreditor of choice, at least throughout the United States, for most ambulatory care organizations. We now accredit thousands of organizations in the U.S. and in other countries as well. AAAHC understands ambulatory healthcare. It grew out of ambulatory healthcare. We choose the very best expertise available to develop our standards and also to train our surveyors. And that all results then in an accreditation process that really helps organizations achieve excellence.
There are a wide variety of organizations that AAAHC accredits. Pretty much any kind of organization that's providing care on an outpatient basis. Ambulatory surgery centers, student health services at colleges and universities, Indian health services.
Accreditation is important to any organization providing health care because it brings in an independent third party to come into the organization. And that person, that surveyor, brings with them the wealth of knowledge and experience and the resources of AAAHC.
I think what makes AAAHC unique in the marketplace is the fact that we are peer-based.
In this drawer, who does your date checks and rotates your medicine?
Our staff does it on a monthly basis.
Our surveyors mostly come from accredited organizations, and so we ourselves have been through the process. We know what it was like on the receiving end, so to help other organizations to get through the process is very helpful.
The surveyor cadre is made up of physicians and dentists, nurses, administrators, pharmacists. So these folks all work in the ambulatory care environment. So when they come to an organization to perform the survey, they're not only there as a AAAHC surveyor, but they're there as an ambulatory care professional that understands what all the organization is going through, not only in providing day-to-day operational things, but what it takes to get ready for a survey.
Our approach is also consultative and educational in that we're not looking for a gotcha or for it to be merely an inspection of your organization. It's an opportunity for our organization to help the organization becoming accredited to improve the manner in which they provide care to their patients and improve the level of safety that they offer to their patients.
It's not a matter of being in compliance with our standards. It's a process of take what you do at your healthcare facility and use the standards as a guideline and show how the mixture of the two really is going to elevate healthcare.
The main benefit that I see to being AAAHC accredited is the credibility that it gives us in the eyes of the public. Patients are very savvy now. Healthcare consumers are very smart about their choices, and they ask us often if we are accredited. And they may not know what all the detail of that is, what it means to be accredited, but what they do know is that it means that you've met a certain standard for safety and for quality, and that's what they're really chiefly concerned about.
AAAHC is recognized by every state that either requires accreditation or otherwise regulates ambulatory health care. We're also deemed or recognized by the federal government's Centers for Medicare and Medicaid Services as an approved accreditor. We're proud of the fact that we work with the United States Air Force all over the world, as well as the U.S. Coast Guard. And I think every third-party insurance company now recognizes AAAHC accreditation.